You can't make this up. No one makes this up. You cannot make this up. But for hundreds of years, no one believed us. And if it had not been for the advent of the camera, many of us would still not be believed. So picture it. 2 Black women, 2025, in the richest country on earth, doing the most human thing that the body can do, and that's bring life into the world. And the system designed to help them instead puts them out, holds them up, and puts them in danger. I need y'all to make that make sense. Come on, set a spell. So 2 videos you can't unsee, but I'm not showing it here. In Mesquite, Texas, a young Black mother, Carrie Jones, arrives at Dallas Regional Medical Center in obvious, excruciating labor. Her mother says they actually called ahead. I saw the video myself, called ahead. So that means a couple of things had already occurred. If you called ahead, what you got? You already have your paperwork in position. Why? How would I know that? Because I myself have given birth. Not once, not twice, 4 times. So I am fully aware how this works. The video that has now been seen by tens of millions of times shows this young woman, Jones, doubled over in a wheelchair, screaming that her baby is in her backside, which means the baby was in the birth canal. Any woman knows the feeling, and you know baby is crowning. And the nurse continues to ignore her pleas that she needs help. And she calmly continues to take her information and her questions. Let me explain something to you. If you're in active labor, the first thing that they're supposed to do is get you to L&D, labor and delivery. Put her in a wheelchair, ma'am. We're going to get all of this information when we get you upstairs, but let's get you on a monitor. Let's check and see how far along you are, XYZ. But guess what? That didn't happen. And her son was born minutes later, stressed, eyes open, and had already had his first bowel movement in utero. That's a sign of fetal distress that can lead to breathing problems and long-term complications. Now, that baby has to undergo a battery of tests because adults in charge of his safety upon arrival into this physical realm decided paperwork mattered more than his daggone life. And the center of another video that I just saw, let me just stop. This is just too much because anyway, so let's finish up with this first woman. So LaCrista Vaughn is the RN who went viral for appearing to ignore. Ain't no appearing, honey. Let's say it what it was. She was ignoring this woman's pleas for help. This young Black mother was in active labor while she's screaming for help. She's already been seen in another video telling somebody to turn the camera off with this blank look on her face like she has no compassion whatsoever for Black folks. Baby, if this is the wrong business for you, then you need to carry on anyway. So from what we understand, she has not been fired. The hospital has her on leave while they quote unquote investigate. There's nothing to investigate. The video says it all. And then just as we're still processing this one, guess what, folks? In Crown Point, Indiana, a family says, ain't no says, let's just say what it is. See, I'm trying to be professional and I don't know how to be professional with this one because this hits home for me as a Black woman and as a Black mother. This hits home for me. So this woman was kicked out of a Franciscan Health Crown Point hospital while she was in active labor. Baby, can we make this make sense? Does any of this make sense to you? She is clearly in active labor, breathing. So the staff allegedly told her she wasn't past 3 centimeters and wouldn't admit her. So they're wheeling her out of the hospital while she's breathing and obviously in pain. She and her husband make a decision to go ahead and leave because they're putting you out anyways. 8 minutes later on the side of the road, her husband delivers their baby in a truck with no doctors, no nurses, no emergency personnel, nothing. Panic, pain, and sheer will to survive is the only thing that got that baby here and his parents. They end up at another hospital only after the baby had already been born. Let me explain something to you all. These aren't historic. These are not once in a lifetime deals. These happen historically. That's just this week. These are the ones that you saw, because this is not new in our community. And the reason why I'm furious about it is because I've lived it. I've been the Black woman whose body was talking and nobody wanted to listen to me, and I begged for help. 4 years ago, I fainted on the side of a road after being refused care by a local clinic or doctor's office in the city where I currently live. I was in obvious distress, begging because I couldn't breathe. Sharp pain like knives in my abdomen, and telling them, y'all, is something wrong? I know I'm here for my appointment, but where's my doctor? Well, we're getting ready to close. We're getting ready to close. You should head over to ER because it sounds like you're having a heart problem. Not a heart attack, a heart problem. You could have triaged me right there to see what the issue was, but you didn't. You didn't. Okay, so instead of care, I got suspicion. I remember a paramedic's voice after I'd fainted and I had slightly come to. He said, I know who the hell that is. Yank her ass up. See, in this system, a Black woman lying on the ground in pain is not a patient. She's a problem. She's a stereotype, a body to control, not a life to protect. So they assumed at that very moment I was on drugs. He thought he knew me by calling a name. Nobody asked, what if this is internal bleeding? Nobody asked, what if this is a tumor? What if this is a life or death moment? And I ended up in the hospital and still received no real answers. Let's talk about that. No real care. And I ended up walking home alone with the piece of the IV still in my arm. I'll never forget that. And I learned later what the problem was and ended up having to have emergency surgery and several blood transfusions. It took a Black woman doctor to pick up a phone and to call another Black woman doctor for them to beg me to come back into the hospital. And I had a bed waiting on me because they were trying to save my life. So when I watch mothers like Carrie Jones and I watch the other mother looking as if she were getting ready to give birth right then in Indiana, being wheeled out of a hospital, y'all, I don't see isolated incidents. This is a pattern. So let's give you some information that you may not know. The United States has a maternal health crisis. And guess what, folks? Black women sit at the deadliest intersection of that crisis. According to the CDC, the overall U.S. maternal mortality rate fell to 18.6 deaths per 100,000 live births in 2023, down from 22.3% the year before. Now, that sounds like good news until you look closer at who's still dying. For Black women, the rate was 50 deaths per 100,000, more than 3 times the rate for white women, and much higher than rates for Hispanic and Asian. Policy analysts have been crystal clear. Maternal mortality, they're dropping overall, except for Black women. We are the ones whose deaths refuse to decline, whose risk remains stubbornly high, no matter what the national average says, and it's just mortality. The women who die. But behind every death are countless stories of near misses, trauma, and, quote, you're fine, go home, when we are absolutely not okay, when our bodies are talking to us and we're telling you what it's saying and you won't listen. These horror stories do not come out of nowhere. We're not making this up. They're rooted in a long, ugly history of medicine built on the backs and bodies of Black women. The man often called the father of modern gynecology, J. Marion Sims, developed his surgical techniques by performing repeated invasive procedures on enslaved Black women without anesthesia. Their names were Anarcha, Lucy, Betsy, and others whose names we'll never, ever know. He operated on them again and again in agony and in full view of other doctors because the racist belief was, and still is, that Black women could bear more pain. And whether today's physicians know Sims' name or not, the myth he wrote on has never fully died. A 2016 study of 222 white medical students and residents found that about half endorsed at least one false biological belief about Black people, such as that we have thicker skin or less sensitive nerve endings than white people. Those who believed those myths were more likely to rate Black patients' pain as lower and recommend less appropriate pain treatment. This is not one bad apple. This is the curriculum, baby. This is the culture. And so, in 2025, a Black woman can be screaming in a hospital wheelchair and somehow still not count as an emergency. A Black woman can be in active labor begging not to be discharged, and staff can still claim she's not progressed enough as they roll her out the door. Because deep down, the system has trained too many providers to see Black women as exaggerating and not suffering, non-compliant, not scared, strong enough to endure, not deserving of relief. And that's a problem for me. Malcolm X called the Black woman the most disrespected, unprotected, and neglected person in America. That was in 1962. And it's still true today in 2025. And our maternal health outcomes prove it. Unprotected looks like this: being in active labor and being kept in triage for 30 plus minutes while your body is telling everyone in that room that the baby is coming. Being escorted out of a hospital in obvious distress and giving birth on the side of the road 8 minutes later. Fainting on the street with internal tumors and being treated as if you're a nuisance rather than a human being in danger. And if it were not for the cameras, for the mother who hit record on her phone, for the family who filmed the wheelchair ride out of the hospital, for social media forcing these images into the light, people would still say they're just exaggerating, making it racial or leaving details out. Let's be honest. Let's just sit down. If it were not for these fucking cameras, these women would be dismissed as difficult patients and the world would move on. They would move on. And everything that's happening to Black women in these videos is not a glitch. It is the logical outcome of a healthcare system built on historical exploitation of Black bodies, persistent racist myths about pain and biology baked into the training that medical professionals go through, underinvestment in Black maternal health, Black providers, and culturally competent care. Lack of accountability where internal investigations go into a black box and families are left to grieve and guess. When you stack those together, you get Black women dying at 3 times the rate of white women in childbirth, Black families disproportionately experiencing childbirth, stillbirth, and infant loss, viral videos becoming the only leverage some families have to demand justice. Y'all, this is not a series of unfortunate events. It is obstetric racism, the intersection of racism and reproductive care playing out in real time in our faces. And it's a shame that we have to come to these internet streets to get the justice that we deserve. And when you stack those together, you get women dying at 3 times the rate of white women in childbirth, Black families disproportionately experiencing stillbirth and infant loss, like I said before. But let's talk about what accountability looks like. Thoughts and prayers, statements about patient safety, and quiet internal reviews are just not enough. If we're serious about protecting Black mothers, accountability looks like this: real consequences for negligent care. Let's not talk about firing one nurse after the internet explodes, but reporting egregious cases to state medical and nursing boards, publicly tracking corrective actions, and making it clear that ignoring someone in obvious distress is career-ending behavior. Period. Point blank. There needs to be mandatory training that goes beyond cultural competence. Oh my God, I'm sick of that one. Hospitals have to require evidence-based training on racism in medicine, not just implicit bias light. Direct education on Black maternal health and statistics and disparities. Ongoing assessment of whether staff behavior is actually changing. Not just check the box, you've took the training for the year. We know how that crap goes, right? The data's clear. Black patients have better outcomes when treated by Black providers. Like in my case, I had a Black doctor who was a friend of mine who called another Black doctor, and they conferred together to save my life. Everybody does not run in the circles that I do. That's why I'm still here. Period. There needs to be recruiting, funding, and retaining Black OBGYN, midwives, nurses, doulas, and mental health professionals, supporting community birth workers, birth centers, and home visiting programs that center Black families. We should be able to know this. How many complaints sit against the hospital for maternal care? How many Black women report mistreatment, near-death experiences, or dismissals of their pain? What changes are being made in policy, staffing, and practice as a result? Here's what we can do. We should not have to go into labor. We're prepping for war. Does that make sense? Let me say it again, because I think I said that wrong. We should not be going into labor like we're prepping for war. We should not have to go in fighting the staff that is there to help us have a healthy birth. And yet here we are passing around survival tactics. Like, girl, this is what you need to do when you get there. Girl, go on ahead and document that. Go on ahead and turn the phone on when I get there, so we can document this. Who wants to live like that? But that's where we currently are. Bring somebody who can advocate for you, record and push back. Say the magic words. I want this documented in my chart when you're dismissed. Ask directly, are you refusing to treat me, and request that refusal be documented. These are strategies for an unsafe system, y'all, not the care of us all, but just the care that we deserve being ignored. Tell your stories like I'm doing right now, like these families are doing with the mothers and the in-laws taking the videos, like so many Black women have done before us, only to be silenced because nobody believes us until we turn the camera on. Support Black-led maternal health organizations. And push your local hospitals, y'all. Tell these stories. Treat Black maternal health as the public health emergency that it is. Because, y'all, it is. We deserve so much better than just bare survival. Let me say this. No woman should give birth on the side of the road after begging a hospital to take her seriously. No woman should be left screaming in a wheelchair while staff decide whether her humanity outranks paperwork and her screams for absolute help. No woman should faint on the side of a street and be written off as a stereotype, walk home alone, and later discover tumors growing under her intestines that could have killed her. And yet here we are. Black women are still the most unprotected people in this country, in our homes, in our workplaces, in our schools, and yes, in the very medical systems that claim, first, do no harm. We're not exaggerating. We're not making it up. We're not too sensitive. We are surviving a system that was never designed with our safety at the center. And we're done being quiet about it. When I tell you I am furious about this, and it's unfortunate that we've had to go to the internet streets to tell this story, I'm absolutely furious. But we have to tell the story. Y'all, for more news and information that you can always use, head over to brownstoneworldwide.com, Cityscape Radio, and you guessed it, Brownstone Living Magazine. We'll see you.